It's a Wednesday. It's Mansfield today. Nice to have you with us. And being a Wednesday, that means it's time for our medical slot with our resident doctor, Dr. Vicky. Hello, Vicky.
Hello, Jeremy.
How are you doing?
Fine, and you?
It's already February and I haven't even said Happy New Year to you yet.
Happy New Year.
Yeah, thank you. Okay, now, I don't know where you got the subject from, but you sent through the email and I thought, okay, just handle it. Maybe Vicky's had a bad week or something. Why do women need testosterone?
Okay, so we do need testosterone you're probably going to have lots to say, but we need our testosterone, a little bit of it, for a positive mood, good energy, strong muscle and bones. It protects our brain function as well, you see. So we often see perimenopausal or menopausal women with a bit of a low testosterone. They become very moody or moodier than normal. Their energy levels drop a bit, libido goes down or no libido whatsoever. Low muscle mass, they become squishy. All the chicks, I'm so squishy, you know.
Squishy.
Yeah, squishy, it's not nice. Difficulty in building muscle, and even vaginal dryness. So it's not just the estrogen that plays a role in that, but then you also get women with too much testosterone. Mm-hmm. And those would be the type with, hair in funny places, even the toes, chest hair. Also receding hairline like men, this temporal sort of loss. They have abnormal periods or irregular periods. They can have miscarriages, infertility, acne. So those are, testosterone plays a role in all of those things.
Basically, if the female has enough testosterone, if the balance is right, if you're getting enough of this stuff that men usually produce, you're actually quite nice people.
Exactly.
Yeah, okay. That's our gift to you.
Thank you.
Is testosterone.
Thank you.
Okay, but now where does your testosterone come from?
Okay, so there's mainly two places that the testosterone gets made. It's in the ovaries, obviously, and then also the adrenal glands. Some gets made in the fat cells, but those are the two main areas we look at. So you get the ovaries and you get the follicles in the ovaries, which makes the eggs. And the outside layer of the follicle cells are called the theca cells, and those cells produce androgens like testosterone and DHEA. Then you get your adrenal glands. The glands make a lot of stuff. So it's testosterone, DHEA, cortisol, aldosterone. That's got lots to do with your blood pressure control. Adrenaline, noradrenaline. So it's got lots to do with stress. And even estrogen. So the adrenal sort of function relates a lot to what we call the HPA axis, which is your hypothalamus pituitary gland adrenal axis. So that's sort of how the brain talks to the adrenals. Mm-hmm. Okay. So this HPA axis is 1 out of 4 of your major endocrine systems. So it controls your reaction to stress, regulate the body processes like digestion, temperature regulation, immune system, mood, emotion, sexuality, energy balance. So it's quite a
yesterday. So those adrenal glands are a vitally important part of not just the emotional side of a female, but a lot of other areas as well.
Absolutely. So now you can understand when you sort of burnt out or adrenal fatigue, how many things get affected by that.
How's it made?
Look, it depends on the function of your ovaries or the function of your adrenal. So you're looking at adrenal health and ovarian health.
So all of those factors have got to be in a healthy state for it to be.
All of those. So if you're looking at ovarian health, for example, you look at the age of the patient. So obviously the young patient, you might be dealing with polycystic ovarian syndrome, and then they'll have symptoms like acne, abnormal hair growth, insulin resistance, irregular periods. But if you look at the older women, the perimenopausal and menopausal women, that's obviously the ovaries are starting to fail. So they're not going to produce that testosterone anymore. you also look at the hormone, or you try to look at the hormone pathway. So the enzymes that's part of your metabolism of your testosterone basically is aromatase and 5-alpha and 5-beta reductase. So depending on those enzyme functions, it depends on what pathway your body is going to sort of metabolize these hormones. So that's an interesting test. The functional doctors use it's called the Dutch test, where they use a couple of days of dried urine samples from the female, and then they check. They can actually check on those enzymes and enzyme pathways, and if you have to manipulate those pathways to increase your testosterone or decrease your testosterone, you can sometimes.
How? What do you start doing if you're worried about your testosterone?
Okay, so don't just go and have your testosterone checked as a female. I don't think that's you don't just do that. You're gonna obviously go into the patient's history. You're gonna check. Obviously, you're gonna see what the cause was. You're gonna check the ovarian function. So you can check testosterone, estrogen, FSH, LH, cortisol, all of those bloods you can do. You check on adrenal function. Was this patient maybe under long-term stress? That's going to affect your adrenals big time. Mm-hmm. High cortisol level messes everything up. Something simple like if the patient's got sleep apnea, then obviously your brain's not getting enough oxygen, but also not your ovaries. And you can obviously say that about lots of things. You can check whether the patient's exposed to any toxins. So if he's got funny hobbies or aerosols or cleaning stuff or skin products, all of those things can affect your hormones and your enzymes. And then check if they've got any infections or scar tissue, like these patients that had lots of abdominal surgeries before, like multiple cesarean sections, or you can get scar tissues around the ovaries as well, and that can even affect the ovarian function and hence then the testosterone and everything like that. And then what's interesting is cold baths and showers. You've heard people like submerge themselves in these ice baths. Men do that as well, and that can stimulate testosterone production. I don't know if I'll do that, but maybe if I need to. And then weight training also helps. So so that's sort of the aim. And then there's certain dietary supplements and things that helps with testosterone production or lessen it or whatever. And those things are like chasteberry, bacopa, maca, choline, B vitamins, zinc, and adaptogens. So you don't just go onto testosterone. Just check your testosterone. Just take testosterone.
Okay. Well, then, how do you decide on treatment then?
Okay, so if you've now gone through all these causes and you've now worked out what the problem is, then obviously, as I said, you're going to do those kind of things, and stress management and sleep improvement and all of that. But if you then decide, okay, testosterone is now needed, don't just go and do a pellet implant. That will give you like 3 months of testosterone, but you don't know how your body's going to react to that. So then you mitigate the negative effects for 3 months, and you can't get rid of it, and you're starting to get hair loss, and your skin goes, acne, and all of that. Yeah. So I always say, start low and go slow. So start with your topical creams or even the vaginal preparations they can do as well, but then and see how you go. So. Check month after month and just go up slowly if you need to. But then also it's interesting if you are using the testosterone creams on your inner arm, for example, and you're a preschool teacher and you're hugging kids all day long, that's the problem. Yeah. So you can, that can affect them. Yeah. And even the vaginal application, if you're going to use it for lubrication, for example, that can affect your partner. So just be clever with what you use, when you use it, and where you use it. So that's interesting. So it's always, I like the saying that you need the Goldilocks amount of hormones, not too much, not too little, not too hot, not too cold. But there's the saying where the female says, I love it when my brain chemicals and my hormone levels are just right. so I can actually enjoy life. Yeah, it's a difficult one, but you know, it's not just simple, straightforward testosterone.
As you say, take it slowly.
Yeah.
And go.
Start low and go slow. Yeah.
That's a
Be
nice way of thinking.
patient.
Yeah.
Yeah.
Dr. Vicky, thank you very much.
It's a pleasure, Jeremy.
Dan gaan ons die naweek gaan ons vis vang en bier drink. Okay.
Okay, lekker. Enjoy.
No, I was saying us.
Oh, we are. Oh, okay. I'm not such a good fisher, but I can try.
Dr. Vicky Skitter. She'll be back next Wednesday. Tomorrow we'll be talking travel on Mansfield Today. Thank you for joining us. Bye-bye.